From the Health Science Desk of the Boston Globe, I'm Stephen Smith, and this is Be Well Boston. First, your tummy feels like it's doing an impersonation of a high-board diver, and then your head turns woozy, and then, well, you know what happens next. Dr. Raj Krishnamurthy of BU in Boston Medical Center is here with some soothing words for GI woes. So when we have those sorts of symptoms, how do you know if it's food poisoning or a viral bug?
So it's really hard to tell, but generally food poisoning is usually pretty, what we call fulminant. It happens pretty fast. People tend to have a little bit more vomiting. Usually you don't have fever or chills, kind of what we call more constitutional symptoms. Gastroenteritis, the infection, viral infection version of the GI woes, usually it lasts a few more days, loose watery diarrhea, usually have fever, chills, a little more tummy ache. So usually the symptoms are a little more protracted, and usually you have fever and chills kinds of symptoms that go along with a viral infection.
So what should you do about it, and when do you know it's important to head to see your doctor or rush to the emergency room?
So most GI woes get better on their own. They usually last a day or two, and then they resolve. People feel better and are able to hold down a little bit of fluid here and there, little sips, or hold down broth, or things like Gatorade. When you don't have, you're not able to hold that fluid down, if you have high fevers, if you have blood in your diarrhea, if you are vomiting blood, if you develop signs of dehydration, which is just sunken, not able to think, not able to focus. When you stand up, you feel woozy, lightheaded. Those are all signs that you should probably see your doctor.
Hydration, really important, right? To keep lots of fluids in. And one thing people always wonder, particularly if it's food poisoning, is what was the culprit? And there's a tendency to think it must have been what I just ate an hour ago, but that's not necessarily the case, right?
Correct. So the culprit for the food poisoning could have been a day, 2 days, 3 days, sometimes even longer than that. So it's really hard to know exactly what item caused the food poisoning. Sometimes when there's an outbreak after a picnic or a summer barbecue, or a whole bunch of people eating a leftover egg salad or whatever, then you can pinpoint a little bit easier. But lots of times we don't really, we have suspicions, but we really can't tell exactly what the cause was.
Dr. Raj Krishnamurthy, thank you. And for continuing health news, turn to boston.com/health and our Daily Dose blog at boston.com/dailydose.